patients who receive opioids for the first time during hospitalization had a higher risk of continuing to receive opioids months after discharge, according to a new study published in Annals of Internal Medicine.
We found that among patients who came into the hospital not having a history of opioid use, those who received opioids during their hospital stay had double the risk of continued opioid use in outpatient settings months after discharge compared to those who had not been given opioids in hospital.
The findings are among the first to shed light on the little-studied causes and consequences of inpatient opioid prescribing.
We were surprised that we found about half of patients in the hospital were prescribed opioids. This is among patients who came in with no history of opioid use. And these were patients admitted to the hospital for a range of conditions, both medical and surgical. And our findings differed from what we've seen in the outpatient setting, where opioid prescribing has gone down. It was pretty steady in our hospital-based study.
Previous studies have shown that some surgical and medical patients who fill opioid prescriptions immediately after leaving the hospital go on to have chronic opioid use.
This is the first study that has tried to look at the relationship between specific patterns of inpatient prescribing and long-term opioid prescription use.
The authors reviewed health records of over 190,000 hospital admissions of patients over 4 years who had not been prescribed opioids in the prior year and who were admitted to a hospital.
We found that 1 out of every 2 patients in the hospital was administered opioids, and that was surprising to us. And we found that on average, patients were administered opioids for a little more than 2/3 of their hospital stay.
The authors also found that alternate painkillers were rarely tried before an opioid was given.
There are lots of non-opioid choices that could have been used, but unfortunately they were rarely used before trying an opioid. So for example, the use of ibuprofen or aspirin or naproxen was done rarely, and sometimes as low as only 8% of the time.
The authors note that while in some cases opioid prescribing may have been appropriate, they are shedding light on areas for possible reduction of risks to opioids.
So we observed several patterns of opioid prescribing in the hospital setting. While we weren't able to assess the appropriateness of opioid prescribing, things like the duration of opioid use, continued opioid administration right up until discharge. These are things that were associated with continued outpatient opioid use that warrant further study and potentially interventions to change prescribing practices.
For more information, go to annals.org.